First of all, thank you so much on behalf of AGFA HealthCare for your time today, and to the organizers for these interesting sessions. And I think for me, it's an interesting job now because I need to bring all that together. So that's what I'm going to do. From a perspective of how radiologists would like to see all these different AI applications and platforms coming together. So my name is Anjum Ahmed. I'm the Chief Medical Officer for AGFA HealthCare, and also lead the AI and innovation initiatives at AGFA. I'm based in Toronto, Canada, very cold over there. The weather for me is very good here. So that's one part. Now, just a brief note about AGFA. We have been very active in the industry. We have over 100 years of experience in innovation. AGFA HealthCare is part of AGFA Gayward Group. And I wanted to share with you some good news that we have recently received our best-in-class awards as well in terms of our recognition from customers, what the work we have done in imaging IT. And I'll try to reflect upon what learnings we had over the last several years, and more recently with artificial intelligence, because we have also been active in the development, validation, and evaluation of certain AI applications in imaging. You have all heard about how many thousands of AI applications that are being developed and coming up. As of this morning, when I checked the FDA website, there were 1,016 FDA cleared algorithms. Now, out of those 1,016, majority of those are in, as we all know, in radiology, and some of them in other areas like in cardiology as well. So radiology has been at the forefront. And what have we learned as a result of this? Because one thing that I would like you to keep in mind as we go forward and try to understand, yes, there are over 1,000 AI algorithms out there in the market. You'd see that some of them compete with each other, but there are others that complement each other. And that is the approach we kept in mind in regards to the integration, that how do we want to make specialty-based clinical packages. But one key area that really came up was, how do we go about deploying AI solutions when there are so many of them and there is fragmented ecosystem? And in the feedback from customers have been, or prospective users have been, we are not going to be able to evaluate all these different AI applications or algorithms out there, and we do not know which one will work for us. So that was the key first ask. How do we ensure which one is going to work with us? And then the second aspect is, how do we validate? Do we validate pre-deployment? Do we validate after the deployment? But if we don't like it after deployment, then what do we do? And then the other aspect was, how do you integrate all those into your workflow? Because we have been talking about workflow today, and workflow can be at several levels, right? It can be at your PACS or enterprise imaging, as we'd like to refer it, or it could be with your risk application. Where do you go into the level of integration? And that's where we have seen now a consensus being developed with the large academic sites or research institutes or hospitals that give me one solution that eases my integration layer. So kind of creating that one data pipe or tunnel that feeds into your PACS systems. But how would that look like? For that, you need a platform or a marketplace, because that is where the platform strategy is going to be able to consolidate all these thousands or hundreds of AI algorithms out there that you wanted to evaluate or test or use in your system. So what did we do? We launched what we call as the RUBEE framework for integration of artificial intelligence into enterprise imaging PACS. And this approach allows us and our customers the flexibility to think about deploying AI from three different perspectives. And what are those three different perspectives? You might be a large academic institute or a network of hospitals who are looking at scaling your journey with AI, across multiple AI applications. So obviously your starting point is usually with the platform, because that's where you have hundreds of AI applications. And that is something that we have announced recently. You heard the earlier presentation with CARPL, the collaboration and partnership that we have established to embed the capabilities of that marketplace into your PACS system natively. And then there is another profile of customers who are interested in only specific AI applications. They might not be looking at the large scale deployment. And the third, as you might have heard already, some platforms have 100 AI applications and others have 120, 130, but then there are 1,000 still that are remaining, right? And you might want to use those. So we have also established a framework for integration, RUBEE integrations, so that your choice of AI algorithms that are not on any particular platform or a marketplace, or you might be developing on your own in your clinical enterprise or institute, you want to experience the same integrated workflow. So we have developed the RUBEE integrations framework as well. The benefit of this approach is that you get to choose the best of AI applications that are available for your clinical requirements. You're not forced into by a particular solution provider that, hey, you know what, my solution is the best, you have to go with it. But this is where we are bringing this flexibility with this platform strategy by giving you the choice to not only validate and evaluate, but also do some post go live analysis as well. So it becomes your single user interface, your data channel. Now, irrespective of any AI application that you want to activate or choose on the platform, we are bringing one consistent user experience with the RUBEE framework that I spoke about. So you might ask me, what is RUBEE? What does RUBEE do? If CARPL is behind with the marketplace, and then I have my PACS with you, AGFA, what will it look like? I want you to consider this in 5 specific areas, which I'll talk about in the next slides. Number one, before a radiologist even opens a study, what they want to ensure is that the study that I'm opening, I have some visibility with intelligent, smart work lists, that the AI results are available or not. So we give you a real-time view of what those look like. Workflow orchestration, the ability to distribute cases to the relevant specialist based on the relevant findings from a particular AI algorithm. So instead of you trying to sort out, this particular chest CT, for example, was done for a different clinical manifestation, and now there is an incidental finding. So our routing rules and engines can be intelligently crafted to distribute those cases to those specific clinical users in the hospital. The other aspect, the third one, is advanced visualizations, or I would like to say predictive visualizations. AI generates a lot of data. It could be measurements, it could be heat maps, it could be display of those specific findings. To be able to embed those natively within your PACS, and we have eliminated the need for third-party viewing applications because you want to reduce the number of clicks. Hanging protocols is another discussion. How can we automate the hanging protocols? And I'll briefly talk about those. Now, if you have all these hundreds of AI algorithms, a lot of metadata is being generated. So analytics and reports, how intelligently we can display those results and metadata is also going to be relevant conversation, which I'll talk about. So I'll give you an example of each of these 5 key pillars of our RUBEE strategy in terms of work list prioritization. Certain hospitals, they want to separate a resident work list versus a radiologist work list because they want to probably show certain type of cases where residents can do an initial vetting, and in certain cases they do not want to show AI results to certain group of physicians or resident trainee radiologists. So there are multiple ways where we can orchestrate and create these intelligent work lists. The other aspect which I spoke about was the workflow orchestration. Intelligent distribution of cases, caseload management or case distribution based on specific findings that the algorithms are picking up and then being able to display those. So this is something that is intelligently built into our enterprise PACS system, leveraging the metadata generated by AI applications. Advanced visualization I spoke about. There's debate in the industry whether you want secondary captures, a lot of series and extra images being created. Do you want to keep them in your storage, or do you want to leverage some GSPS overlays, hide, unhide, so that the storage capacity is not disrupted? So there are multiple ways of how we enable advanced visualizations. I spoke about enhanced hanging protocols, that when you launch your study, the images are intelligently displayed for you, whether it is the raw image or the AI processed image or a relevant prior scan for this particular patient, so that all the automated measurements, volume doubling time, if it's the case of chest CT again, all that is displayed to you. And customers of ours who have gone live with this approach, they're saying they are between 20 to 30% more efficient with their reporting turnaround times, because all this automation based on detection, display protocols that we have created for them kind of makes it easy for them to report this. So this is something that we have published as well recently. Now, if all this metadata and all this information is being created, how do you intelligently structure certain reports? So we leverage obviously standards-based formats, whether it is DICOM objects or HL7 feeds coming in from the AI solution providers. The ability to create structured reports, which is natively built into the enterprise solution. One-click sign-off for you, for example. So this is something that we work with our customers, get to understand how their report templates and automation requirements are to be able to make it easy. But there is another aspect of this as well, that probably you do not agree with the results of AI, and you do not want those results to stay in your archive somewhere. And that's where CARPL has provided a very intelligent workflow in terms of how do you accept AI findings, or how do you reject or unaccept those specific findings because you may not want to have them. Now, there is another aspect, which is the quality, probably the legal, medical legal aspect as well. Because if you're doing all this, you're evaluating, you're using AI in clinical environment, one thing that really comes up is the algorithm performance drift. That, all right, you tested algorithm a few months ago, now you've gone live, you've started using it. For some reasons, how do you know it is still performing at the same level? So CARPL has a very intelligent analytics module that provides value on two different fronts. First one is the pre-deployment, during the pre-deployment phase. So this module allows you during pre-deployment that you have your curated data samples, and then you could test and validate those curated data samples against, let's say, 3 different algorithms. So same scans, 3 different algorithms. Before this, how we used to do it? Sit down with the radiologists, they had their spreadsheets, and there is a list of scans that we are going through, multiple radiologists, 3-hour sessions sitting together. So it was an exercise. But with this approach, you do not now need a 3 or 6 months trial, because all you need to do is you identify your curated data samples, upload them, and the results will be generated so that you can compare on this particular data sets how these 3 or 4 different algorithms are performing. That's the first part. Now, the second aspect of this is, which is even more important, is post go live. How do you know it is still performing based on your comparative analysis? Because now what you have is your radiologists are the ground truth, and the AI algorithms are generating data. So that's where it becomes more relevant as well to see how much false positives or true negatives and all these AUC. So your population-specific AUC on a day-to-day basis, and these reports can be generated. So that's where it really becomes very relevant to ensure a very high-performing radiology department, where you have all these tools that are embedded with all these different applications, bringing you really good clinical intelligence in terms of analytics that are embedded. They're part of your workflow. Today, you have no visibility how your AI systems and algorithms are performing. So that visibility is more enhanced, improved clinical decision support, and obviously, we will be works in progress, adding more generative AI capabilities as well for further automation and dissemination. I want to thank you for your time. We are at booth 212. And if there are questions, I'm happy to take questions as well. Otherwise, we are at booth 212. Please.
Thank you. Thanks a lot. Any questions for Dr. Ahmed from the audience? I'll maybe have a few questions. I mean, I think you're doing really great work in trying to standardize these workflows. And how do you see if you speak with radiology departments and the ROI for them, their return on investment, what is your main focus or driver to explain in a simple way all the things that you're doing on the workflow side?
This is a very good question, because whenever we start a conversation around AI, Few years ago, radiologists would say, you know what, I like this particular AI vendor. I want only this one. And then our question used to be, what clinical problem are you trying to solve? And as you start asking those questions around, the gaps, they would tell us, hey, AGFA, why don't you do an end-to-end workflow and a gap analysis for us? And that exercise led us to understand, what, they do not need one algorithm. They might actually need more than one algorithm. And that is what we came out with, what we call as a clinical packaging strategy, which meant that if we have created a breast AI package, in that breast AI package, we might have 3 different solution providers with their algorithms. So comprehensive breast AI solution. Then similar with what we did with lung nodule management package as well. So the radiology departments, they've also learned and evolved over the last few years in terms of what they were asking before compared to now what it is available in the market. And that's one of the reasons they are now going with this platform marketplace-based approach, because 3 key areas that they ask the influence and improvement in the workflow. Number 1, nobody want to miss any findings. So accuracy in detection. And that's one of the reasons they want to validate and evaluate. That's number 1. Number 2, which is really important, how it is going to be integrated into your packs, because that is their bread and butter. That's what they work on. And that's what they're asking us, AGFA, there are so many platforms out there and there are so many AI providers out there. You decided to go AGFA with CARPL, okay? But we want to go with something else, for instance. Where is your value? So the workflow, there's 5 core pillars that I've showed you for RUBEE. That's the work that we have developed so that we are focused on automation, orchestration, visualization, keeping it very standard and within their environment. And they are telling us, we didn't even need to be trained because it was so natively built into our system. That's number 2, workflow is important. And the third, which is a major thing for us this year and going forward, is what clinical outcomes are we improving? Answering the question, yes, AUC numbers are good, sensitivity, specificity is good, but what clinical impact is it having? So we are working with a few, we did that 10 years ago when we developed our first chest X-ray algorithm. The first thing we did was publish the data and the results. So this year also we are going to continue to do the same. Thank you.
Thank you very much. And that probably links the latter to also seeing beyond radiology how AI is used, the results are used by clinicians, physicians to really push for precision medicine, impacting diagnosis, outcomes, and so on. So
yeah, I precision medicine, I like to call it precision health intelligence, because you are bringing in not only imaging analytics, but you're bringing data from electronic health records. And then as we move forward, there will be talk about genomics as well, radiogenomics, radiology and genomics coming together, and now with pathology. So collaboration between several departments is going to, and that's where you need platform like this, because all the imaging data is on single platform, and that's what we have done. I have started seeing in Europe, actually, as compared to North America, I live in Canada, but I've seen here in Europe that consolidation of imaging specialties is taking place. I was in Italy last year and I heard from a head of department of diagnostic imaging. They have radiology, pathology, all under one diagnostic imaging umbrella. So that's happening.
And the platforms will become even more important.
Absolutely.
Thank you so much. Thank you all for joining this session. Thanks again, all speakers. And see you at the next session.